What is a maxillary sinus lift procedure? When do we need to do this procedure while placing implants? So as we all know, we have air-filled cavities on either side of the face. They are called sinuses, and we have two maxillary sinuses on this part of the face. As we grow older, these sinuses pneumatize and they become bigger in size on the expense of bone. So while placement of implants, the sinuses are really pneumatized, become bigger. It's difficult to place implants because hardly there will be any bone. Where there is lack of bone to place implants below the sinuses, we do a sinus lift procedure. There are two types of sinus lift procedures. One is direct and the other one is an indirect sinus lift procedure. So what is a direct sinus lift procedure? When there is absolutely no bone in the back teeth region to place implants, we need to literally open the sinus from the sides through the mouth, retract the membrane carefully, place bone graft into the sinus and wait for 6 months for this bone to ossify. Later we place implants into this grafted bone. So what is an indirect sinus lift? Indirect sinus lift is a very simple procedure where there is minimally bone lacking to place implants. Most of the times, dental implants are placed simultaneously with indirect sinus lift procedure. Here, we make the drilling protocols minimally, lift the sinus with special instruments through the osteotomy site, then pack the graft and place the implants simultaneously. So can everyone undergo sinus lift procedures? No. There are certain conditions like chronic sinusitis, which is strictly a no for sinus lift procedures. Also, it's better to avoid sinus lift procedures in heavy smokers unless and until they are ready to cease smoking or reduce smoke. The success rate of sinus lift procedures depends on various factors like the condition of the sinuses, how meticulous the sinus lift procedure is performed, and also the quality of bone graft used.